Okay, so today we're going to talk about something that pretty much all of us will deal with at some point: low back pain. And if you've ever had it, you know how it can leave you feeling stuck, wondering what actually helps. So, in this explainer, we're going to dive right into what the latest research and clinical guidelines say are the best ways to manage it and, get back to your life. If you haven't watched the first video explaining what low back pain is, I recommend starting there. For this one, though, we're jumping straight into the big question: what can you do about it? All right, first things first, and this is really important. When you have back pain, it can feel incredibly isolating. It's so easy to start worrying, but the first and maybe the most crucial step is just realizing you are absolutely not alone in this. I mean, look at this number. A staggering 84% of people on the entire planet will experience back pain at some point. That's not a small number. That's almost a universal human experience. It really shows that this isn't a sign that something is uniquely broken or wrong with you. It's just a very, very common part of being human. And it's not just a minor ache. The World Health Organization has identified low back pain as the single leading cause of disability around the world. Now, I know that sounds really serious, but think about the flip side of that. Because it's so common, it's also one of the most researched conditions out there, which means we now have a ton of good data on what actually works. So, whenever something is that common, a lot of myths and honestly, bad advice tend to pop up around it. And these myths can create a lot of fear, which can actually get in the way of getting better. So, let's start by busting some of those myths by looking at what the evidence really tells us. Okay, let's tackle the biggest one right out of the gate: this idea that your back is this fragile, delicate thing that's super easy to damage. The science is really clear on this. It's just not true. This fear often makes us want to avoid movement, but that's the exact opposite of what your back needs to recover. I mean, listen to how the NHS puts it. Your spine is one of the strongest parts of your body. It's not made of glass. It's a really robust structure of bones and discs and powerful muscles that are designed for bending and lifting. It's built for strength. Here's another huge source of anxiety for people: that feeling that you need to get an MRI or an X-ray to see what's wrong. But the clinical guidelines are pretty clear. Scans are rarely needed. They're really only for when a doctor suspects a serious condition, which is only about 1% of the time. The thing is, scans often find stuff like disc bulges in people who have zero pain at all, and that can create a lot of unnecessary fear and lead to treatments you just don't need. All right, next up is a really big one that so many of us were taught for years. It's the idea that when your back hurts, you need to go lie down and just rest completely. For decades, that was the standard advice. And this slide really shows you just how much our thinking has completely changed. Up until the late 90s, bed rest was the go-to treatment. But now, we have so much high-quality research showing that long periods of bed rest can actually make things worse. It weakens your muscles, it deconditions your body, and it can actually drag out the pain. The advice today has done a complete 180. So, if bed rest is out, then what's in? Well, the answer comes from a really strong consensus in all the leading clinical guidelines from all over the world. They all point to a very clear and consistent first-line approach. And what's great is that this approach is actually refreshingly simple. Step one is just reassurance: understanding that most back pain gets better on its own, and that hurting doesn't mean you're causing harm. The absolute cornerstone is to stay active and just gradually get back to your normal life. Then, structured exercise can help build up strength and confidence. And while manual therapy like massage can feel good, it's really important to remember that it should only be used as part of a bigger treatment plan that includes exercise. This quote really is the central message. It's not about hiding away and waiting for the pain to disappear. It's about gently and confidently getting back to your life, because movement is actually what helps your back recover. Okay, so just as the guidelines tell us what to do, they're also really clear about what to be cautious of. These are treatments that aren't routinely recommended, usually because they either don't have strong evidence behind them or, in some cases, might even be unhelpful. So, for most common low back pain, major guidelines actually advise against routinely offering these kinds of interventions. So, why is that? Well, for things like back belts, traction, or even acupuncture, the evidence just doesn't show a meaningful long-term benefit for most people, especially when they're used as the main treatment. The guidance on medication has also gotten a lot clearer in recent years. The whole focus has really shifted away from the long-term use of certain drugs. For chronic pain, strong medications like opioids are no longer recommended because the risks are just too significant. Same goes for certain nerve pain medications. But what might be really surprising to you is that even something like paracetamol or acetaminophen, taken all by itself, isn't a go-to recommendation anymore, simply because the evidence shows it isn't very effective for back pain when compared to staying active. So after busting all those myths and looking at the real evidence, what does this all actually mean for you? Let's try to pull all this together into a clear path forward for recovery. Honestly, this might be the single most important takeaway from this whole explainer. No matter how bad the pain might feel in the moment, the long-term outlook is overwhelmingly positive. Most episodes of back pain get better. You have to trust that your back is resilient and that it has an amazing capacity to heal. And of course, we have to share a quick disclaimer. This is all for general educational purposes. It's definitely not a substitute for getting a personal medical assessment from a qualified healthcare professional who can give you advice that's tailored specifically to you and your situation. Let's end on this final, really powerful message that just sums it all up so well. The evidence shows again and again that recovery isn't about waiting for the pain to be completely gone. It's about staying engaged with your life, trusting in your body's strength, and just confidently moving forward. So I'll leave you with this one question. What is one small, enjoyable activity that you can do today? It doesn't have to be a marathon. It could be a short walk, a few gentle stretches, or even just getting up from your chair a little more often. Remember, the path to feeling better almost always starts with that one single step.